Hi, everyone. Alex, I think you're muted.
That happened last time too. Hello, everyone.
Oh. Okay, I think we've got a few more that are coming in here. They're connecting to audio, so we'll give them a minute. Okay, there was one. We've got one more. Oh, Tyson. Tyson's trying to get in here.
Alex, can you hear me?
Yes.
All right. Can't see me though, can you?
No, but that's okay. I guess we can't see your smiling face.
I wonder why that is. Let me check here. How'd things go this afternoon?
Pretty good. Pretty good. We had our first forum at noon, and I'd say that went really well. So we hope that this one goes just as well, and you have lots of questions for mainly Josh, because he's more of the health insurance expert than I am. But
You always like feedback though, right?
Yeah,
you
absolutely. Okay, so it looks like
There we go.
it looks like Tyson is in, but we're not going to be able to hear him. That's okay. So Alex, would you like to get started?
I sure can. So welcome everyone, and thank you for joining us for our 5:30 Community Health Forum for our Larned Area Chamber of Commerce Association Health Plan. So I am really excited about this benefit that we have been working really hard to bring to our community, and specifically our chamber members, to help with recruitment but also retention of employees. So I want to thank you for joining us, whether it's by phone call or tuning in through Zoom. Thank you, Charles, for joining in via video. But your participation is what is going to make or break this benefit, meaning that, if we don't have enough community participation, we may unfortunately not be able to do this. So I thank you for taking the initial steps in participating with us this evening. So I won't talk your ear off the entire time. I'm going to let Josh do that. But I want to introduce our health advisor, Josh Sapp with Heartland Benefits Group. So he's going to tell you all about this benefit, the plans that are going to come up with this, as well as the next steps and different ways that you all can get involved. So Josh, take it away.
Awesome. Thank you so much. I'm going to admit Tyson back in here. It looks like he's trying to get back in. There's going to be a little of that as we go. I'll kind of break from what I'm saying and try to get more people in as they come about. So, yeah, this is going to be a fantastic opportunity for not only the Larned Area Chamber, but the community as a whole. Before I get into the presentation, I'll share my screen, but I want to make sure you all understand that I am recording this, so we can put this out to the community, to the public. Alex will be sending this and or the first recording that we did at noon out, just so everyone has an opportunity to kind of see what we're trying to do and hear it straight from the horse's mouth, if you will. And I'm not calling myself a horse, but you know what I mean. So before I get to the presentation that I'm going to share my screen with, I just want to kind of hit 3 documents that you should have received from Alex, okay? The first is going to be the brochure, the health plan brochure. It looks like this. It's kind of got some blue stripes. It says corporate plan management up at the top. It's got my information there, sponsored by the Larned Area Chamber of Commerce. That document right there is the nuts and bolts of this program. It's going to cover your basic plan descriptions, your exclusions, your inclusions, program objectives, enrollment requirements, all the plan benefit designs and coverages. Let me get someone else in here. They're trying to join. Perfect. They're late. We're going to have to dock them. They're going to get a penalty for it. Okay.
I do want to chime in, Josh, real fast.
Yep.
If any of you have to step away for a minute or something like that where you're not able to listen to a portion or the rest of this meeting, like Josh said, we are going to be recording it. So you will be able to look back or listen, watch all of the material that Josh is going to present. So don't feel like if he's going through things, you have to take notes super fast. This all will be available after. So just wanted to
Also,
put that out there.
thank you. Also, know that no question is a dumb question. So if you have a question, I'm going to leave it up to you if you want to unmute yourself and voice your question, or you can just type that question into the chat bar on your device as we go. Either way is fine with me. And please ask the question when it's relevant. So if something comes to mind as I'm saying something, please ask the question then. So first document was that brochure. There's your nuts and bolts of the plan. That's going to give you everything you absolutely need to know as the plan participant, okay? The next document is going to be a frequently asked question page, FAQ. There are 18 questions on there, along with a general timeline moving forward as we get through the process of getting this plan off the ground. That should answer a majority of the questions that most consumers are going to have. If you find something that, if you come up with something that's not on there, please voice that. Send me an email. You have my information on this handy dandy little key points notes page. My information is right down at the bottom of that page. Do not hesitate to call me. I'm the benefits advisor for this program. I am kind of holding, not kind of, I'm holding Alex's hand through this process because she's not an insurance expert, unfortunately. She's a chamber expert. And so that a lot of these things are what we're going to go over throughout this presentation. So let me jump straight into that and share my screen. Let's see here. Okay. Share this bad boy. Okay, can you see my screen? Just nod if you can. Fantastic. Okay, let's get into the chamber presentation. Let me move this thing out of the way. Let me move myself out of the way here. Okay, so I'll give you a brief introduction of who I am. Let me put this down. There we go. So I'll give you a brief introduction of who I am, who Heartland Benefits Group is, why the Larned Area Chamber of Commerce has decided to partner with us in this effort. Give you a little background as to what how this health plan has now been allowed by the state through some changes in the state laws. So anyway, I'm Josh Sapp, President and CEO of Heartland Benefits Group. We are an advisory company. A lot of times you'll hear the word broker out there. I absolutely hate the word broker. I do not consider myself a broker. I'm an advisor. I have, and this is kind of cliche, but I have the 100% best interest of my clients. And that would be the participants of this chamber health plan and the chamber themselves as the sponsor. So Heartland Benefits Group, how we differ from other advisory companies and brokerages out there, is that we're working toward futuristic, if you want to use the term futuristic, or trend breaking, forward thinking strategies to contain the costs of what is typically a number one or number two budget item for employers out there. If you look at any business out there, you look at their budget, their health benefit is going to be their second, sometimes third, but most oftentimes second or first most expensive item on that budget. And so what we've been conditioned in the healthcare marketplace to accept is that our costs just so happen to go up every year, and sometimes our benefits get worse every year. So let me first start by asking you this question to kind of give you some, get you in the right mindset, I guess, get your gears turning a little bit. It's kind of a rhetorical question, so you don't have to raise your hand. Plus, I can't see you. So if you just think about this, you're a business owner. That's why you're participating in this meeting. I'm gonna escape out of here and see if anybody else is trying to get in. Okay, so you're a business owner. That's why you're here. You're trying to look at this opportunity, this option to provide benefits to your employees. Who would be okay, or sometimes maybe happy with a 5% increase at your employee benefits, your health insurance, whether that's with Blue Cross, United, Cigna, Aetna, Humana, wherever? Who would be okay with a 5% increase? Okay, now who would be okay with a 10% increase? When I ask those two questions, I'll probably get 80% of the people in a room to raise their hand with the 5%. And then most people would raise their hand for the 10%. Why is that? Why are we so accepting? We've been so conditioned to accept these increases every year without any kind of statistical data to back that information, to know exactly why our benefits are getting worse over time, while our costs are going up. And so there's that old definition of insanity, right? Doing the same things over and over again, expecting different results. Well, if we continue doing what we're doing, we're not going to get a different result. And we know that small businesses and large businesses alike are feeling the hurt and the pain of cost increases every single year and benefit decreases, if you will. So what we're trying to do, let me give you a little bit of an introduction, a little bit more of an introduction. Oh, I guess I got to go all the way back to the beginning, Alex. I haven't reset my presentation. So I am a benefits advisor, Heartland Benefits Group. That's who the chamber is partnered with, because we're doing things that other brokerages or advisory companies aren't doing. Trying to contain cost, mitigate cost exposure year over year by putting in strategically placed processes in place to mitigate costs over time. We're going to utilize a local third-party administrator. That is a company called Corporate Plan Management out of Topeka. They've been in this space for 30 plus years. So that's a long time and been very successful in what they do. They obviously, because they're in your backyard, they know the demographic. They know the market in the Midwest, especially Kansas. So that's one plus. We have them right in our backyard. We can utilize the information that they're able to give us to manage more closely the trend of this program. We're going to utilize a local pharmacy benefit manager. So a PBM, or pharmacy benefit manager, a local PBM just in the state of Kansas, but they have a nationwide network, is called Oriad RX. Oriad RX, because they're local, they're in the state of Kansas. They're actually owned by the president of the Kansas Pharmacists Association. His name is Matt Morrison. We can use those local resources to better manage with empirical data to better manage this program for a sustainable program. We're going to utilize A+ rated carriers. Some of you are probably familiar with Gerber Life Insurance, US Fire, Companion Life. Transamerica is the largest insurance company in the world. They do billions of dollars a year in insurance. So A+ rated carriers, this is going to be full 100% ACA compliant insurance. It's just going to be built a different way, okay? And when I say that, I basically mean we've built this particular program from the ground up. There's not another plan the exact same as this plan in the world, okay? We have brought together, and I'll kind of get into this more, but there's an insurance board that Alex and the chamber have handpicked to put together. I'm sorry, you're probably going to hear my 2-year-old daughter maybe laughing or crying or running around in the other room. So please forgive me for that. But the chamber's put together an insurance board that's going to hold the fiduciary responsibility to oversee this plan as we go. I don't have any decision-making power. As your advisor, I advise the insurance board in what routes we could take, and they decide what ultimately is going to be for the best interest of the Larned area or the Pawnee County community, okay? Oh, I went 2 here. Let's go. Okay, so everyone's familiar with what a chamber is. Some of you may be familiar with the duties of a chamber, what their goals are, what their ultimate intention is. A chamber is always wanting to look after the growth of the immediate community that they serve. Okay, so whether that's, you know, creating an environment and encouraging businesses to grow, okay, to promote the local resources, utilize as many local resources as we can. They're doing and finding things to facilitate those opportunities for growth and the well-being of their membership. And so this health plan is just one additional new thing that chambers in Kansas are again allowed to do now, that the chambers are taking advantage of to ultimately impact the overall wellness of the community. So an association health plan, that's essentially what this is. Okay, it's on the state level, it's called an association health plan. On the federal level, it's called a MIWA, or a multi-employer welfare arrangement or agreement, but it's a health plan for the chamber. That's essentially what it is. So let me give you an example just to kind of get you in the right mind or the right headspace. So I've got a group of, my group A is 5 lives. Okay, this small employer mom and pop shop down the street has 5 employees. Okay, and then I've got organization B, who's a manufacturing plant down the road, down the highway, who has 1,000 lives, who theoretically would be getting better rates per capita. You would immediately assume the 1,000 life group, and you're absolutely correct. Well, a lot of people would think that, but they just don't understand why. Well, one of the biggest aspects of providing economical or affordable costs is the size or the buying power of the group. So that 1,000 life group is going to get better rates per individual than the 5 life group. So it's really, really hard for small businesses, small mom and pop employers, to provide economical or affordable or attractive benefits to their employees, which ultimately produces less recruitment opportunity to hire skilled workers. It creates higher turnover, so your retention is minimal, and that higher turnover creates more dollars out of the employer's pocket in training new employees, because they have to continually train new employees. So instead of having one small group of that group A, which had 5 lives, what if we took the welding shop down the street, the salon, the nonprofit over across the road, the county, the school district, all of these different entities that are part of the chamber membership? What if we brought all of them together to use as buying power to make everybody's benefits more affordable? That's what we're trying to do. So I've kind of already covered this, but more affordable insurance because of the buying power of hundreds, if not thousands of employees, instead of just your own 3 to 5 to 10 lives. If you're a farmer, I know you're kind of in rural central Kansas, you probably have a lot of farmer members. They can't afford, I mean, they have to pay ridiculous amounts of money. They have to basically cut off their arm and sell it to get their health insurance. Well, everybody is hurting like that. If you're a small business, and sometimes even big businesses are hurting. So if we can come together as a community to buy down the rates by having a bigger block of business, that's a huge community win right there for everybody involved. So when we have a bigger group, we have more healthy people absorbing the cost of those unhealthy people. We're gonna have sick people. That's just, it's inevitable. We're gonna have sick people. But the more healthy people we have on the plan, the more cost effective it's gonna be, because that group of healthy people are absorbing the risk of those unhealthy folks. So if you have a group of 10 and you've got 1 cancer patient, that's going to be some extremely expensive insurance. But if you've got a group of 250 and you have 2 or 3 cancer patients, it's probably going to be really good insurance, probably going to be really affordable. So we want to keep as a community effort, come together as a community, all the businesses unite in the Pawnee County area, Larned Area Chamber of Commerce, to do this as a group, to come together, because again, we can't keep doing the same things over and over and expecting to have different results. It's just not going to work. We're going to utilize all the local resources that we can in an effort to keep small businesses thriving. We want to use those local providers, those local pharmacies. We want to help increase recruitment opportunities, retention, and just an overall healthier workforce and overall healthier and a better and increased wellness of the community.
Hey, Josh.
Yes, sir.
You said to ask a question,
Please.
timely
Please.
manner.
Yep.
How does the premiums are affected by a group? Say initially they have a small number of claims, but then the following year, there's a large number of claims in the group. How does that affect the premium that year or the following year?
So the underwriting that goes on, the underwriting process for this plan is going to be used is going to be analyzing the statistical data that is current and present. Okay. So we're not looking at the health data over the last 30 years. Once we get this plan off the ground, we're going to take the claims data from the current year and use that in the following year or the following renewal. So if this current year, if the first year has minimal claims, that's going to be used, that information and data is going to be used in the underwriting process to determine what the next year's rates are going to be. None of us can see the future. The underwriters and the actuaries can't either. They can get a pretty good guess based on health data, but the rates are determined based on the current condition of the health the current health condition of the group at this moment in time. Does that make sense?
Sure. So basically you're saying if they stay healthy, the rates are going to stay healthy, but if they get sick and there's a lot of claims, then you're looking at some increase in premium.
Maybe, maybe not. So the structure of this program, we're going to be paying for actual claims as they come in. If you're out there with Blue Cross or United or Cigna or Aetna, you're going to be paying what's called anticipated premiums because they don't know what you're going to be spending in claims. Neither do we, but we're going to be paying for actual claims as they come in, and the health trust that is established is going to hold the unused claims dollars, the unused premium dollars in a bank account, in a trust in your community where we can actually use that. Let's say we had a bad year, but we still have, $50,000 in retention. And after shopping dozens of reinsurance carriers and underwriters for year two, the best we could get is a 5% increase. Well, we can take that $50,000 and we can use that to absorb that 5% increase and not have to pass on an increase at all to the consumer. Does that make sense?
Sure. Is that something that's done?
Yep. That is exactly how this program is going to work.
Okay.
Yep.
All right. Thanks.
You're welcome. Great question. So all of you are probably familiar with the Kansas Bankers Association. Maybe you're familiar with the Kansas Veterinary Medical Association. Some of you may be familiar with the Kansas Association of Independent Crop Consultants. What do you think is the common denominator of all of those associations that I just listed off? Well, that's a rhetorical question. I'll just tell you the answer. All of those associations are like industry or industry specific, meaning only financial institutions are allowed to be members of the KBA, the Kansas Bankers Association. Only independent crop consultants can be part of the KAICC. Only veterinary medical clinics can be part of the KVMA. Okay, so there has been a bill for decades that allows those types of like industry or industry specific associations to do this, to offer an association health plan to their membership. So the KVMA does have a health plan that they offer, and corporate plan management actually administers that health plan. The Kansas Bankers Association has one. The Kansas Association of Independent Crop Consultants has one. Corporate plan administers that health plan as well, that association health plan. So though they've been able to do this for decades. However, chambers used to be able to do this back in the 80s, but then they weren't allowed to do it after for a certain period of time. And then now, as of May 1st of last year, it was written back into that pre-existing bill that chambers can now offer this as a benefit, a health insurance benefit to their chamber businesses, their business members, and those businesses' employees. So that was written into law beginning May 1st of last year. Governor Kelly, she didn't sign it, nor did she throw it in the trash. So by default, it just slid across her desk and passed. My buddy Lee Modisett, he's the Director of Government Affairs and Communications at the Kansas Insurance Department. You can call him, email him. Don't tell him I gave you that information. I'm kidding. He doesn't care. He'd love to talk to you. So I'm confirming with him every single day that we're still good to go. And we've got a few chamber health plans off the ground since May 1st of last year. So this is how it's going to work. The chamber, like I said earlier, has put together a group of, Alex, would you say probably 7? There's 6 or 7 members there?
I believe so. I'd have to go back and count, but I think that's about right. So
you've got representation from local professionals, okay? There's a county representative there. These individuals are making the decisions, because I don't know, I wish I knew Larned more than I do, but I don't know the demographic there. I don't know the needs there. These individuals are local professionals, insurance experts, executives of some of your bigger employers in the area. They're all on this insurance board making decisions for the best interest of the participant group, okay? That group's gonna meet frequently, gosh, I wish it were only quarterly or on an annual basis, but I actually meet with my other insurance boards probably monthly, or we talk monthly to make sure everyone's on the same page, how the plan is running, monitoring it with a fine-tooth comb. Because all of these small businesses haven't ever been a group together before, we're going to have to request health questionnaires. Okay, that is and I'll get, Alex, will you remind me, since I forgot earlier today, will you remind me to go through the health questionnaire if I forget?
Sure thing.
Thank you. So the questionnaire is super, super easy. That information that you put in that health questionnaire, I only need 5 years worth of data on that initial health questionnaire. I don't need the gout that happened in 1982. We need a current snapshot of the health of everyone who wants to participate in this plan. Also keep in mind, even though you fill out that health questionnaire, you're not obligated to participate, okay? There's going to be an initial underwriting period, an initial enrollment, a review of that enrollment, and then a final enrollment as we get through this process. So you're not obligated until you sign the dotted line at final enrollment and we get this thing off the ground. So when we get those health questionnaires, we're not going to disclose those. If you have that note page in front of you, you have a timeline there. Those health questionnaires are going to be released on September 1st. We can't obtain any health data outside of 120 days. So that would put us at September 1st for an effective date of January 1. So those health questionnaires, we're going to build a census off of. We're then going to take the questionnaire, the health profile, the census, and the health plans that we've designed that are detailed in the brochure. And we're going to send that off to a dozen or more A+ rated carriers and underwriters. What's the beautiful thing about shopping every single year with dozens of competitors? I just gave you the answer. It forces competition. Out there on the traditional insurance marketplace, there's minimal competition. So what we do every single year is shop our groups every single year with dozens and dozens of reinsurance carriers and underwriters to promote or force competition to drive down the rates as far as we can possibly get them every single year. Once we get those rates back from the underwriting period, which is roughly 3 weeks, 2 to 3 weeks, we're then going to disclose an enrollment link and the rates. That's when enrollment opens, okay? So if you like the rates, fantastic, go ahead and enroll. If you don't, no harm, no foul. You don't have to continue participating at that point. Any questions there before I move on?
So the rates won't vary at that point, depending on who enrolls and who doesn't?
Great question. So there is the underwriter has the right to review and revise. Let's say we get 200 people to fill out the health questionnaires from 30 businesses. Well, what if only 100 people from 10 businesses like those rates, those initial rates? There was a 50% change there. So therefore, if there's more than a 10% delta or change, the underwriter has the right to review the change in that census and revise if necessary. Keep this in mind. Down in Southwest Kansas, we did this with 7 chambers who did this all together. The Larned Area Chamber doesn't have that opportunity. So I know that's probably rolling around in some of your minds. The Larned Chamber doesn't have the opportunity to come together with multiple chambers at this point. But there are 7 chambers down in Southwest Kansas that all did this together. We got their plan off the ground January 1st. Leading up to that effective date, we had 1,290 people complete health questionnaires from 240 businesses. From that 1,290 health questionnaire profile, we only had like 300 people enroll. The change was obviously more than 10% there. The underwriter and the reinsurance carrier only increased the rates 2.1% because that new census didn't provide any or a significant amount of risk compared to the initial group of 1,290. Does that make sense?
Sure.
Okay. Great question. Thank you for being diligent about those.
You bet.
So here's your coverage. You might be asking, well, are my doctors going to be in network? We want to work so badly with the Pawnee Valley Community Hospital. It's PVCH, right, Alex?
Mm-hmm.
Yep.
Okay.
Yep.
Okay, fantastic. We want to work with them, but as of right now, we are still in that conception phase with them in those conversations. So we haven't nailed anything down with them yet, but you can still use your local provider who is more than likely, I would guarantee you almost, because I've never had anybody prove me wrong, that your provider in Kansas is most likely part of the Providers Care Network. So you can use, I'm going to show you this. Alex, please remind me of this again if I forget at the end. We're going to do a search of the Providers Care Network. We're going to do a 50-mile radius around Larned, Kansas. And I will show you that there's probably hundreds and hundreds and hundreds of all specialty providers within this Providers Care Network. Any claim that gets billed in Kansas is going to be run through the Providers Care Network. That's where we're getting our clients the steepest discounts on care. Nationwide, because we travel, right? We don't just stay in Kansas. Well, if you're with Blue Cross Blue Shield of Kansas, more than likely when you step foot out of Kansas, you're paying out of network costs. They make some exceptions, but you're more than likely paying out of network costs. Well, with us, we're going to build in 2 different networks, one in Kansas and one nationwide. So you have coverage everywhere. That way, is it Charles?
Yeah.
Yes.
That way, when Charles is going to Maine to fish for lobster and he falls off the boat, I hope he doesn't. I'm knocking on wood right now. But let's say Charles falls off the boat and breaks his leg, but he survives. He can find an in-network provider in Maine by searching the First Health Network and pay in-network costs, even though you're in Maine. So that's the beautiful thing about what we're doing here, okay?
By the way, Charles loves lobster.
Does he? Oh, me too. I've been on many cruises and I always keep those lobster tails coming.
You bet.
Okay, so prescription benefit managers. That local prescription benefit manager that we're utilizing has no conflict of interest. They don't have any relationship with the reinsurance carrier. They don't have any relationship with or any monetary relationship with the TPA. They don't have any monetary relationship with me. They're looking out for the best interest of the participants and the local providers, the pharmacy providers, okay? So right now, if you're with Blue Cross, you're probably utilizing, I hate to keep using Blue Cross. I'm going to use Cigna from now on. If you have a policy with Cigna, you're probably taking prescriptions that have some kind of manufacturer rebate that you could be getting. But thank the Lord, Cigna is keeping that from us, okay? They're so nice. They're so generous to be keeping those rebates, even though those are technically ours as consumers. So with this, by utilizing a local PBM, we're getting the program 100% of all of those manufacturer rebates for all drugs that all participants are utilizing. That's going to go back to that health trust to use to make benefits better over time, to absorb any potential future increases, so on and so forth. There's no price spreading, so I don't know if I have any pharmacists on this call or not who are listening to me, but there's no spread pricing or price spreading, however you want to say it. That means there's going to be a fair deal offered, reimbursed back to the pharmacy. So your pharmacies, your local pharmacies love this. CVS and Walgreens and Walmart hate this because they're not getting more profit. Our local pharmacies love this because we're not clawing back funds from those local pharmacies. And the beautiful thing about doing all of this local is that every single piece of this is 100% transparent. Okay. There's an extreme conflict of interest by the traditional carriers out there when they're offering minimal data, minimal transparency to the consumer. That is concerning to me. And so we want to be different than that, make sure everyone knows what this plan is doing and how it's running.
Do most of the Kansas, like mom and pop pharmacies, participate in this prescription benefit managers? Or
that's a great question. Yeah. So since it's a local PBM, you might think, well, the network might not be expansive. Okay, it is. They have over 69,000 pharmacies across the country who are in that particular network. Down in Southwest Kansas, there's no issue there. And that's a little bit more rural than Larned is. So I would imagine that I only know of.
We have one.
What's that?
We have one pharmacy in Larned.
Okay, is it a locally owned or is it a chain?
Yeah, locally owned.
They're gonna be part of this network. I promise you. I guarantee it.
Okay.
Okay, that's a great question. Over 69,000 pharmacies across the country that are in network that will accept that PBM's relationship. So what this means, how it works for the member, okay? Let me give you an example just to kind of preface this. Participation threshold of 65%. I've got 10 employees, okay? I want to participate in the Larned Health Plan. I want to offer my employees this benefit. So I'm a chamber member. I have all of them. Okay, let me back up. I know that Jimmy over here or Sally, my maintenance people, one of them is sick every single year, all year long, and that's why I assume, because I'm ignorant to insurance as a consumer. I'm not versed in it. I don't know much about it. I'm not an expert. So I assume that because they're sick all year long, they're the reason why my Blue Cross or United or Cigna rates are going up every year. That's probably not the reason why, but that's what I think as a consumer. Well, what if there was no participation requirement of 65%? I could just slough my one really, really sick person off onto the chamber plan and keep my 9 healthy people on my Blue Cross or United plan. What if everybody put their really, really sick people on this plan? Do you think it would work?
No.
Absolutely not. So we want to reduce the effect of adverse selection. We want to encourage more participation with this requirement of 65% to get more healthy people on to reduce the effect of those unhealthy people. Okay. You might then be asking, what about those who have coverage elsewhere? Well, let me give you another example. I've got 10 employees. 3 of them have coverage somewhere else. One's on their parents' insurance, one's on their spouse's insurance, one has insurance through the healthcare.gov marketplace. They have what's called a qualified waiver. So they could technically just say, nope, we don't even want to participate. We're good with what we have. Now, all I need is 65% of the 7 to participate to be able to offer it to them. Am I crystal clear on that?
Yep.
Fantastic. Okay, so again, just in simpler terms, those who have qualified waivers don't count against your participation percentage. Now, let's say that those 3 opt out and do not complete a health questionnaire. So they're not considered in the underwriting. Therefore, they can't participate even if our rates come back 20% better than what they have with their spouse, or what they have with their family, or what they have out on the marketplace. So I would always encourage, even if you have a waiver, go ahead and complete the health questionnaire, go through the process, and then at the end of the day, you have the choice to take either or. Am I good there? Does that make sense?
Sure.
Okay. So the chamber is not, the chamber is simply acting as a sponsor for this health plan, okay? They don't get any kind of HIPAA compliant confidential information. They don't want that liability. The administrator gets all of that information to administer the plan. So each participating chamber member will get their own monthly invoice for their own premiums for the participation of their own employees, okay? Alex isn't going to get an invoice that she has to then split up and itemize out and then send on to the participating businesses. You're going to get an invoice directly from the administrator for your participating employees. Now, because this is complete insurance, ACA compliant, full health insurance, the employers must pay at least 50%, this is the federal law, at least 50% of the most economical single rate that's offered for each employee that's covered. So we'll get to an example here in a second, and I'll go through it just to make it a little more clear. Once you get that check or that invoice, you're going to send those premium dollars to that premium check to the administrator, not to the chamber, not to me, to the administrator. And they then delegate those funds to where they need to go. So here's a quick example for you. This is a sample plan. There are 5 different health plans that this particular group is offering. Okay, the Larned Area Chamber of Commerce has 4 different health plans, 3 different prescription options. Therefore, there's actually 12 different combinations that you can make with the Larned Chamber Health Plan. Beautiful thing about it is, just like with this one, there are 3 different prescription options. Charles, do you think mine and your prescription needs are the same?
Probably not.
Probably not. And we can probably assume that that's pretty consistent among anyone that's listening to this. Mm-hmm. So each one of these different prescription options, plans 1, 2, and 3, are going to have different varying coverages for prescription. And that's all detailed in that brochure. So if you have further questions about that, please don't hesitate. At any time you can call me, email me, whatever. So let's look at this for the sake of that 50% contribution from the employer. Who on here can show me or yell out, Charles? Oh, darn it. What in the world? Can you guys hear me?
You can, Josh.
You can.
Just lost the chart you had up there.
Okay, here we go. I'm going to get back into it right now. Sorry about that. Okay, so we got there. Okay, who can spit out or yell out the lowest or the most affordable single option that's on that page?
Lowest single option.
Oh, hold on a second. Somebody chatted. 424.63. Good job. I don't know who that is, but good job. 424.63. Okay. That's this one right here. Okay. So all I have to do as the employer is pay half of this towards each of my 10 employees who are on the plan. Now, because I'm the employer, I'm getting the invoice. Maybe I want to pay 70% of this 424.63 towards all of my employees. Maybe I want to pay 100% of the single up to 424.63, and I want to pay an additional 10% to the family. I don't necessarily care as long as your invoice matches or your check matches the invoice amount and you've paid at least 50% of the single option toward each one of your employees that are participating. Does that make sense? That's pretty standard across the board.
These are monthly rates, correct?
Correct. Yeah.
What does DPC stand for? I know health savings account, but what's DPC?
Yeah, great question. I imagine Larned doesn't have a DPC. It's a direct primary care. Essentially, you might be familiar with, if I were to say it this way, a membership clinic. It's where it's not insurance. You would have a catastrophic insurance on top of a DPC, a direct primary care. Essentially what that is In short, you pay a monthly fee to go to I got another chat here. No, we do not. Thank you. This person is smart. I love this person. You go to this clinic, you pay a monthly $100 or $150, and you can go see that doctor for literally anything other than major surgeries. And, you know, they can do sometimes they can do stitches or maybe resetting the shoulder or something, but they do everyday care at a DPC. And then if it's anything crazier than that, you would go utilize your catastrophic insurance to go to a facility that can actually provide that service or do that procedure. So it can be cost effective. And in this particular example, I just put it on there to show that we literally build these plans from the ground up. However that insurance board wants to design these plans, we can design them that way.
What is your what's this called? Display or whatever based on, as far as numbers in the plan itself? What are these figures based on?
These dollar amounts right here?
Yes. Yeah.
So,
like how many people have participated in the health plan itself?
Well, this is just an example. This wasn't an actual group.
Okay.
This is just an example. But
Okay.
this is not an age-rated program. So what the BUCAs out there, Blue Cross, United, Cigna, Aetna, Humana, BUCA, what they like to do is age rate a program. Well, what do they know happens to every single one of us every single year?
Get older.
We get 1 year older. Absolutely, Charles. And what does that mean for their profits?
Yeah, it's going to cost them more.
They make more because they're going to increase your rates, right? Hoping that you don't have some kind of catastrophic, procedure illness happen. So that's bogus to me. We don't age rate these plans. Everyone's going to have the same costs. So whether you're with the salon down the street or you're with the welding shop, if you completed a health questionnaire, these are going to be your options. Granted, keep in mind this is still an example, but whatever we disclose to you, everyone will have the option to take any one of those health plans at those dollar amounts. Okay, so the next step, again, you're not obligated to this program until you sign that dotted line at the final enrollment. Okay, and even then, if we don't get off the ground, you're not obligated because we didn't even get it. We weren't successful in getting it off the ground. It's going to take everyone's proactive fervor, if you will, to make this thing happen. As a community, you have the opportunity to come together, to join hand in hand with your local community to build this program and step away from what we are all tired of. Small businesses and business owners, self-employed folks, entrepreneurs that can't get economical or affordable benefits because it's just so expensive by yourself. But if you can come together as a community to do it, I mean, why not at least come alongside the chamber in this effort? So we got to have everybody complete a health questionnaire. If those who have waivers are adamant about not completing the health questionnaire, well, then sorry. If these rates come back 10% better, you don't have the option to say yes. So, it's not my fault or your fault as the employer that they didn't complete the health questionnaire. Okay, Alex,
Josh?
any other questions from anybody before I get to my examples?
Yeah, Josh, just a quick question.
Sure.
Why is it that our chamber can't co-op with other chambers that you had mentioned previously? There's a group that got together. How come we can't participate in that group?
Charles, I love you, sir. I can't wait to meet you and shake your hand because that's a fantastic question. So there is a requirement, there are two requirements in that bill that was written into that pre-existing bill that allows chambers or associations to do this. The first is that the association has to have been established for at least 5 years. Alex, I imagine the Larned Area Chamber has been established for more than 5 years, correct?
You are correct.
Fantastic. Okay. The second requirement is that the association has to have at least 5 members. You guys have 107 business members, 27 nonprofit members, and then your citizen members or community members. Okay.
The bad news.
What's that?
I said, now for the bad news.
Now, well, it's not necessarily bad news. I've actually had an individual chamber get better rates than that Southwest Kansas Chamber group, and they had 1/12 the amount of people participate. So there's a lot that goes into the number of participants, but there's also some good weight in the health of the group as a whole. Yeah. So Alex could only get 15 people to enroll, and if those are the right 15 people, this thing's super affordable. If they're all in their 20s and they don't have kids and they don't have spouses and they're young men who are too prideful to go to the doctor, this is going to be one affordable program, but I don't see that happening. So here's what we would call the bad news. That group down in Southwest Kansas of 7 chambers, they actually came together in 2008, so 12 years ago, and formed an entity for this without knowing that the insurance was going to be available to them. So they came together for something other than insurance at the time. So they meet the 5-year requirement, right? Because they established 12 years ago. And there are 7 chambers in that group. So they meet the 5-participant or 5-member qualification. So there were roughly 1,600 chamber members. We initially had 240 some businesses fill out the health questionnaire, 1,290 employees. We only started with just under 300 people, but now we're up to closer to 400 people. So we've gained about 25% in participation, and that's going to continue to grow by small businesses getting tired of what they have, being tired of what they don't have, and joining the chamber, or they're already chamber members, but now they're taking advantage of the health benefit. Does that answer your question, Charles?
Yeah, basically, their group is closed out, I guess it sounds like.
Correct. Yeah, correct.
Okay.
So let me share my screen once more.
Wait, one more question, Josh?
Yep.
Just a thought. What if we wanted to establish a group of chamber members or different chambers from different small cities? Is that still possible?
Absolutely. You could, but you'd have to wait 5 years to
Okay.
well, you wouldn't have to wait 5 years to establish the entity. Alex could go out to the Hutch chamber, to the wherever chamber, and get 5 or 10 or 12 or 3,500 different chambers to join her coalition, if you will. But you wouldn't be able to offer the benefits as a collective group until 5 years down the road.
Okay.
It's something to think about anyway.
It is. Yeah. We have other chambers that work informally with no established entity, with dozens of other chambers, like the Southwest Kansas Chamber Group. They are an established entity, but like Southeast Kansas Chamber Group, there are a dozen chambers down there that work together hand in hand, but they don't have a formal entity. However, they're going to establish an entity where they all work together, and then they're going to do insurance on their own until we're able to do it as a collective group of those dozen chambers all together.
Sure, that's an interesting idea. Yeah.
Yep. So here's the health questionnaire. I didn't mention this earlier, but this health questionnaire is super, super user friendly. This is directly on the corporate plan website. You're going to get this very link. I'm not sending you to corporateplan.com, go to main menu, go to forms, click on this one. I'm sending you this link. So as soon as you click on the link, it's going to bring you right here. How easy is that? That's perfect. You're then going to put your name of your employer, employee's full name. Anything that has an asterisk needs to be completed. If you forget to fill out an asterisk by the end, it will not let you submit. So that's a fantastic way to filter or to make sure people complete everything that needs to be completed. So these are the exact preferred plan options that you would select. Okay, I know that I don't know the cost, but knowing my situation, I need the $1,000 deductible, and I need plan A prescription option. And I'm an employee only, or I'm a spouse, or I'm a family, or whatever, or I decline. If I'm waiving, I decline. Okay. Status, single, married, divorced, widowed, retired. I need, if you did choose family or spouse or child, I need to know that information. I need to know everything that's happened in the last 5 years. If you checked yes on any of those things, I need some details. Please also remember, I get this question a lot. They call me and they say, Josh, I have way too much information to type out in this little tiny space. I ask them, did you try to continue typing? No. Okay, try typing some more. Okay, so you can literally type an entire novel in that one little space and it's going to work fine. All right. Any prescriptions that you're currently taking, sign, date, submit. That's it. Okay. I have 1 2-year-old daughter. I have a really healthy wife. I'm super healthy. We don't take any medications. It can take me literally 32 seconds to fill this thing out. However, if I have 14 kids and 72 prescriptions, it might take me more than 2 minutes. So just depends on how much information you have. All right. Pretty easy. Remember, that's going to come out on September 1st. Okay. This is the Providers Care Network. You can access this information without any kind of special code. You go to providerscare.net, click find a doctor. That's pretty self-explanatory. A lot of people get to this point and they say, Josh, what's the access code? I don't know. I don't have an access code. Well, did you read right here? It says PCN. Okay, perfect. Find a doctor. Type in PCN. Submit. Let's do a radius search. You guys good with that? What's the zip code?
67550.
I love the unison there. Love that. Let's do, is Hutch included in 50 miles?
No, that's 80 miles.
Okay, let's do a 100-mile radius. Let's do all specialties. Submit. Any guesses? Oh, dang it. 6,442 results found.
Wow.
Okay. Okay, so that's, remember that number. Charles, can you remember 6442?
6442, got it.
Perfect. Okay, let's do a provider radius search with the First Health Network. Remember, this Providers Care is in Kansas. First Health is nationwide, okay? So let's do the same exact thing. Locate provider or create directory. We're going to click on locate provider. We're going to do the First Health Network. No specific client code. We're going to start now. We're going to do all providers. 67550.
Correct.
I'm too good. Okay, 100 miles. Perfect. What do you think? I want to guess. Remember, it was 6442 with Providers Care, right?
Right.
What do you think it's going to be with First Health?
5,583.
That's a good guess. It's going to be less. It's probably going to be in the 4,200 range, I would imagine. And no, I didn't do this just a little bit ago before we got on.
You didn't cheat, did you?
Oh, 2,750. So I was guessing high. So there's the difference in the network availability and the expansiveness of those two networks, but you have access to both of those networks, one for in Kansas, one for nationwide outside of Kansas. All right.
All right.
Okay. That's
First Health is the network.
Yeah. So that thank you. That reminded me of something. First Health is the network. It is owned by Aetna, but it is not Aetna's signature network. It is their subsidiary or sister network. So it is technically the largest network in the country.
What? Bigger than Blue Cross Blue Shield?
Yeah. Yep. Bigger than Blue Cross Blue Shield. It's because Blue Cross Blue Shield has these Blue Cross Blue Shields of Kansas and Blue Cross Blue Shields of Louisiana and Blue Cross Blue Shields of Oklahoma. So they kind of itemize themselves out. First Health, which is nationwide, is the biggest network in the country.
That surprised me. Yeah.
All righty. Any questions there?
No.
Okay. That's literally all I have. I can't think of, I mean, I could talk insurance for hours, as you can imagine, and I can talk pretty quickly. But you guys have my information. If no other questions right now, you can call me anytime. Please not at 2 a.m, Charles. I beg you.
No, I sleep. I'm
You're
a good
not
sleeper.
Jake?
Yeah, no, I'm not Jake from State Farm. No, ma'am. I'm wearing shorts right now, but I'm not wearing khakis.
I do have a question.
Yes.
And you know, when you get your bill, okay, and you get a this is how much that your charges are, and then this is how much the hospital will accept. Does that vary depending on whether you're Blue Cross Blue Shield or, the network that you're looking at right now?
Absolutely.
Vary depending on what they'll accept in terms of charges or write-offs?
Yep. They're going to want, because they have a negotiated price with that particular carrier. Every differing carrier has a different negotiated price with the providers in their network. So they're going to be reimbursed in different amounts based on the network.
Right.
We have, through the Providers Care Network, we have a negotiated rate with all of those providers as well. However, we're getting the steepest discount in Kansas with the Providers Care Network. They're right up there with Blue Cross Blue Shield of Kansas. So people like to call it, I'm not even going to say it because I'm not even going to say it. Never mind. But Charles, you're absolutely right. There are different, and that's what's unfortunate. It's concerning about the healthcare industry, the health insurance industry.
Absolutely.
Is there are so many varying prices. You don't have any idea what you're paying for before you go. You would never, ever go and try to buy a car and put an offer in on a car unless you knew what the price was, right?
Right. And I know there's some legislation out there in terms of trying to get that done now, and whether it'll happen and when it will happen, I don't know. The other question I had was on the high deductible plan, where you have a health savings account.
Yep.
Can you choose who you want as far as your depository on that account, and based on what you're going to get as far as interest rates or anything like that, or is it pretty much locked into a?
We work with an HSA administrator. It's a third party that we work with on every single one of our groups. So we can do all of that for you if you want, or you can go on and find your own. It doesn't matter to me one bit. That's all administered by the TPA that is administering the entire plan. Also, Charles, golly, I needed you on the noon meeting because you're reminding me of so many things. The TPA, they're charging a fixed cost, right, to administer the plan. That's built into the premium, just like the profit and overhead is built into the Blue Cross plans. So with that TPA, they're providing all of the businesses that are participating in this. They're going to be doing all 1095s, all COBRA administration, and all Medicare eligibility notifications for all of the employers. Think about that HR headache of doing all of that by yourself as your own business owner and your HR people having to deal with all that crap. The TPA does all of that for all of the businesses that are participating in this health plan.
That's great. Yeah.
Yeah. Yep.
All right. Well, thank you, Josh. Appreciate
Absolutely.
and good presentation.
Thank you. Appreciate that. Anybody have anything else? Now, or speak now, or forever hold your peace, or just email me later.
I want to jump in real fast, just in case any of you may not know where all of these forms, the plan brochure, the FAQs, the key points, any of those forms are. I emailed those out, but they can easily be found at our website, so larnedks.org. And at the top, we have those tabs. Go under the CARES tab, straight down to the Chamber Health Plan. Click on that. And after that, yes.
Alex, I just made you a host. Will you share your screen and walk us through that?
Well, I'm on my iPad, so.
Oh, are you? Okay, never mind then. Never mind.
Otherwise, I would. But it's really, really easy. So go to larnedks.org. At the top, there are, I think, 6 different tabs. Click on the CARES. Well, bring your cursor over the CARES tab. You don't have to click on it. It'll bring you to a drop down. Click the very bottom option, which is Chamber Health Plan. And then that's going to bring you to our Chamber Health Plan page. So that's going to have all of the forms, all of the information, everything that we have sent out. Everything's going to be on there, as well as the recordings of both this meeting and the noon meeting. So you can check all of that out there. If you need more information, I can definitely guide you through it. But it's a one-stop shop for you, trying to make it as easy as possible.
Okay, well, let's be proactive, everyone. Who has a question? Charles, do you have a question?
Well,
No,
Charles's wife has a question. Hold on. Alex, Has there been a lot of interest in this? Let me ask you that.
I haven't heard from everyone, but everyone that I have heard from is really, really excited to learn more about this option. So my fingers are crossed that we're going to have, you know, great participation, and hopefully we can have those great rates for all of you.
It's unfortunate. I use this term a lot. I use this phrase a lot. You can take the horse to the trough, but you can't make it drink, right? You can't force somebody to do something that they're not comfortable with. I think, based on experience working with many, many chambers, that it's a need. People are hurting. People are ready. You know, they're primed and ready to take action and be proactive about finding, you know, benefits that are, you know, cost containing. Somebody messaged me, I'm sorry. That are we're doing things differently. So we're going to get different results. So anyway, I encourage you all, talk about it, you know, spread the word. The chamber is going to continue putting out information, some reminders. They're going to put out that September 1 email communication with the health questionnaire link. I encourage you. If you're self-employed, fantastic. If you're a chamber member that sells Mary Kay on the side and you have a Mary Kay membership with the chamber, fantastic. You qualify. You can participate. So I just want to encourage you guys, let's be proactive. Let's get it done as a community. If you guys have any other questions for me, again, you can email me, call me. This is what I do. This is why I'm here. So thank you all for your time. Thank you for dealing with me, Charles. I appreciate you being lighthearted and letting me use you as an example in many ways.
Great job on the presentation, and I want to thank Alex for putting this together. I wish that, you know, we could do it in person, but I'm being safe. All right.
We can all appreciate that. So keep your eyes open, everybody. Thank you guys. Have a great evening.
All right.
All right.
Thank you.
Bye-bye.